Thank you very much. Good afternoon, everyone. I hope you were able to enjoy your long weekend in August in a safe and responsible way, especially now that 33 of our 34 health units are in Stage 3. Windsor-Essex remains in Stage 2, and the province continues to work very closely and support the health unit in Windsor-Essex. I know that things may be starting to feel more normal now, that additional amenities are gradually reopening for all of us to enjoy. But the higher risk businesses and services that are permitted to reopen in this stage means that everybody has to continue to be vigilant and follow public health advice and workplace safety guidelines in order to avoid outbreaks and risk undoing the tremendous progress that we have made over the past several months. Remember to wash your hands often, stay home if you're not feeling well, practice physical distancing, and wear a mask indoors in public spaces or when physical distancing is a challenge. On Friday and over the long weekend, Ontario reported 134 cases on Friday, 124 on Saturday, 116 on Sunday, 88 on Monday, and 91 today, bringing our total to 39,628 cases. 29 of our 34 public health units confirmed 5 or fewer new cases today, with 16 health units reporting 0, no new cases at all. Today, another 116 Ontarians have had their cases resolved, bringing our total to almost 90% of our cases resolved. To date, 2,782 deaths have been reported, representing an increase of 4 deaths from yesterday's report. Over the last several days, new cases have been primarily concentrated in Toronto, Peel, Windsor-Essex, and Southwestern public health units. Your continued vigilance and collective efforts to protect yourselves and your loved ones from COVID-19 is central to our ability to control the spread of this disease. We are not out of the woods yet, and our response to COVID-19 continues to require a common commitment to following public health advice. Following that advice now will directly impact what kinds of interactions we can have with our friends and family in the future. So please continue to act responsibly and respectfully to keep family, friends, colleagues, and neighbors safe. I will now turn it over to the media for questions. Thank you.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question.
Thank you. Your first question will be from Rob Ferguson at the Toronto Star.
Hi, Doctor. Just wanted to ask, now that we're in Stage 3, I'm hearing more anecdotal reports of companies wanting to bring workers back into the office, and I'm under the impression that the guidance is still work from home if you can. So where do we stand on all that?
Well, I believe the Ministry of Labour actually has some very detailed guidance on their website for lots of different specific kinds of workplaces. So that would be something that each workplace should be checking with the Ministry of Labour website and or calling them for advice. In general, certainly staying home is safer than going to the office. But if you are going to the office, if it's required, or recommended by your workplace, then basically the same measures are recommended. Don't go to work if you're not feeling well. They should be screening people when they come in. Good hand hygiene, washing your hands well, and often making sure there are facilities available close by. Social or physical distancing, trying to make sure that people are sitting at least 2 meters apart. And if that isn't possible, to be wearing face coverings or masks. So those measures are pretty basic for any inside space, and certainly would include offices. But again, I think getting advice from the Ministry of Labour is always useful in these circumstances.
Follow-up?
Okay, thanks, Doctor. Yeah, just to switch gears. In terms of Windsor-Essex, it looks like you want at least one more week of data. Have they progressed at all, or is it more or less static and you're waiting until next Monday to make the decision?
We are working very closely with Windsor Essex. In fact, we have daily phone calls with their medical officer of health and chief executive officer and daily reports. We have sent out the EMATS unit to help coordinate care, and as well, Ontario Health has restarted doing the testing on farms as well. So the health unit is working very hard with the community, with the farmers, in terms of case and contact management, outbreak management. And I would say things are slowly improving, but they're not quite there yet. In terms of the criteria to go to stage 2, we want to be extra careful and not have to go backwards in the future. As you know, the kinds of things we look at are a 2 to 4 week reduction in cases, the incidence tracking capacity, which is good, the health system capacity and the public health unit capacity. The numbers are slowly going in the right direction, but they haven't quite got where they need to be yet, and we're working very closely with them.
Next question.
Will be from Michelle McQuigg at the Canadian Press. Please go ahead. Please unmute your line, Michelle.
Hi, Dr. Yaffe. Can you hear me? Hello, can you hear me?
Yes, I can. Go ahead.
Oh, sorry for the delay. Dr. Yaffe, a question for you about the province's back-to-school plan. You've likely heard a number of concerns being raised by parents about the physical distancing measures or lack thereof in classes that are not going to be changing size in any way. The Sick Kids report that is the basis of the provincial plan does seem to advocate for some degree of physical distancing when possible. And today, the federal health officials, Dr. Tam and Dr. Yu, were also saying the same thing, that the school environment ought to be optimized to allow as much physical distancing as possible. Where do you fall on that question, and do you feel the government plan is up to scratch in that respect?
Yes, I understand that this is one of the areas that people are concerned about. And I certainly understand concerns about children's health. We all know that the most important thing for children right now is to get them back into school for their social, physical, mental health, their learning, and so on. So I believe at this point we've put into place quite reasonable measures. In fact, they are stronger than most other provinces have put in place. In terms of physical distancing, 2 meters is optimal. The Sick Kids report actually does talk about 1 meter, maybe as good. We are hoping for 2, but I think that everybody will be very aware of the need for distancing, for trying to move kids' desks as far apart as possible, keeping in mind that kids may not always follow that. It's only one of the measures. We're going to be cohorting. We're going to be ensuring screening, so hopefully sick kids or staff do not go to school, and hand washing facilities. So there'll be multiple measures in place in addition to as much social distancing as possible. We'll have to see how it goes. If there's any cases reported, we will certainly follow up immediately. And if things need to be changed, certainly that will be something we'll look at. But I think at this point, as I say, it's probably we've got more measures in place than other provinces. So we're very hopeful that schools will be able to reopen and kids will be able to stay healthy and safe as well as their staff.
Follow up?
Thank you. Yes, on a similar subject, a lot of the school boards are still finalizing their specific back-to-school plans, but the Toronto District School Board has released a draft version. And one of the measures that they're planning to proceed with is to get rid of sports until further notice, until cleared to go ahead by provincial health officials. That seems to be somewhat at odds with the guidelines governing stage 2 and 3 that have had sports resuming for a while. Do you sanction the approach of getting rid of sports for the school year, or are there potential drawbacks for kids that might have been looking to this as part of a return to normal?
Well, I mean, we aren't really calling it a return to normal. we're going back to conventional school scheduling as much as possible, but it's not going to be normal. Kids from grade 4 and up will be required to wear masks. Under that, parents will be encouraged to have their kids wearing masks. Staff will be wearing masks. Lots of other things there won't be any mass gatherings or auditoriums. So it's not a return to normal. We are still in a pandemic. So I think not having sports at this point is reasonable. Certainly, if they want to do something, they can submit a plan to us to review. And we would see if it makes sense in terms of preventing and controlling the spread of infection.
Next question, and this will be the last question.
Will be from Cynthia Mulligan at City News. Please go ahead.
Hi, Dr. Yaffe. I was hoping you could clarify a comment that you made on Thursday. It's causing quite a furor on social media. I asked you about why teachers wouldn't be tested in schools as a precautionary measure, and you responded by saying in part that just under 50% of tests in low-risk areas were false positives. Could you explain that further for me? Because I really don't understand. Are you saying that in areas that are out of hot zones that there are a lot of false positives?
So yes, I understand that there's some lack of clarity. We are talking about a test that is a screening test, basically. And so we're testing, if we are testing people who we have a population that has no COVID or very little, the prevalence is extremely low, and you test somebody and you get a positive, actually, in fact, I think over 50% of those positives will be false positives. So in those instances, there'll be a second test recommended, and the second test will often then be negative. So that will be ruled out as a case. If the second test is positive, then there be considered a case. If the test is done in a population where there is COVID, as the prevalence or how common the infection is goes up, the positive predictive value of the test goes up. So that is, what are the chances, if you have a positive test, what are the chances that the person actually has the infection? The chances go up as the prevalence of the infection goes up. So it depends on how common the infection is, and it also depends on how good the test is, the sensitivity and specificity. So we have a pretty good test, but if we're doing it in a population where COVID is rare, the positive predictive value is very low. And that's why it has to be repeated. And if it's false, it will not be reported in IFAS. It will not be counted as a case.
Follow-up, this is the last question.
Okay, thank you. So I'm assuming it's not falsely inflating the numbers. My next question is, again, about distancing. And parents of young children in elementary are understandably extremely concerned about the distancing. And you yourself mentioned how Sick Kids was hoping for greater distancing, yet in the government docs, there's no mandate for physical distancing. Is that because it's simply a practical measure that there isn't enough classroom space to increase distancing among elementary students, and that it's just impossible to actually do? Or is it because you genuinely feel that it's going to be safe enough?
Well, as I said, the Sick Kids document actually mentions 1 meter, may be as good as 2. We are sticking with 2, but it's somewhat heartening to know that the pediatric experts are kind of saying 1 may be good enough. I think there were many considerations that had a role in making the decision around the classroom size, and I think the bottom line is we, from public health point of view, want as much social distancing as possible. We want everybody to be screened. We want everybody to not go to school or work if they're sick. We want everybody to wash their hands and keep away from other people as much as possible if they're not in their social bubble. And we'll have to see how it goes with the schools.
Thanks, everyone.